There's some people who are like, I don't want to take any medications. They come in here, lay down the law. And I was like, cool. Like, I support you in whatever way you want to be supported. And then we get into the diet. They're like, give me the medications. Send me all the prescriptions. I'll go to CVS right now. I'll
Yeah.
double dose it. And so but it's a balance, right?
Hello, and welcome back to another episode of the Birth Lounge podcast. All right, you guys, if you didn't know, I, for the last 5 years, have been struggling with getting a diagnosis of MCAS, which is Mast Cell Activation Syndrome. It used to be called a disease, so MCAD, Mast Cell Activation Disease, but it's recently been changed to a syndrome. And don't ask me why or even what the difference of those are. But in our bodies, we have mast cells, which is M-A-S-T, so mast cells. And these are cells that are part of your immune system. And in a typical healthy body without MCAS, your mast cells actually help your body fight off things like germs and allergies, and they're responsible for releasing histamine. Now, normally this histamine is typically released when there's truly a problem, like an infection or an allergy. However, with someone who has MCAS, sometimes your mast cells go a little haywire. They become a little on the fritz, and they release their chemicals, this histamine, when they shouldn't. And even when there is no threat, or when something isn't a threat, but they perceive it as a threat. So for me, we've had such a tough time figuring out what triggers my histamine responses and what triggers my mast cells to actually go crazy. At first, we thought it was food. Then we thought it was environmental allergies and pollen that I had never been in contact with. Then we started to think, was it stress related? And our latest hypothesis is actually it may be connected to my hormonal cycle of menstruation. However, in the midst of all of this exploration and testing, I ended up pregnant. And so we've had to stop all the testing. But lucky for me, I've actually not had any MCAS symptoms, and I haven't had an episode since being pregnant. Now, episodes and flares and symptoms can range from anaphylaxis, which is one of my symptoms, all the way to just a little trouble breathing and feeling dizzy and a fast heart rate, which also makes diagnosing and identifying MCAS in people relatively difficult. As I have been on my own MCAS journey, I have not only put together a care team of collaborative providers for myself, but I, naturally, went to the internet to find other practitioners that were specializing in MCAS so that I could continue to learn and explore different options for myself so that I can then take back to my care team and make sure that we were covering all of our bases. Well, today I'm so excited to have on Dr. Zac Spiritos, who is a neurogastroenterologist. And don't worry, I know that's a mouthful. I'm going to have him explain exactly what that is. But one of the things that drew me to Dr. Zac is the fact that he truly looks at you in a whole body perspective. Dr. Zac specializes in complex digestive conditions, dysautonomia, and medical weight management. His practice combines evidence-based medicine with personalized care, focusing on nutrition, movement, nervous system regulation, and targeted therapies. Now you know why I was so eager to have him on the show. What allopathic medicine doctor focuses on nervous system regulation? But one thing for me that I have found super interesting is the more dysregulated my nervous system is, the more likely I am to have an MCAS episode. Well, in today's show, we're actually going to be talking about the definition of Mast Cell Activation Syndrome, the clinical guidelines for diagnosis, and what the current research says. Although it's relatively new, so you're going to hear me ask questions where Dr. Zac says, we don't really have that information. We're not really sure. The research hasn't really gone there yet. He's also going to share with us the range of symptoms and what flares might look like for different people, what labs and tests you can ask your provider for if you think that you may have MCAS. What are the causes of mast cell activation syndrome? What are common triggers? And then what do we need to know in terms of management? I know this episode is not specifically pregnancy related, but as I have become a little bit more open and shared about my MCAS journey online, I have had so many of you share that either you have MCAS or you have similar symptoms and you haven't known exactly what it is or where to go or what questions to ask. And so I'm hoping today's episode can be a jumping off point for you for exactly that. Plus, don't worry, I'm going to be asking him all about MCAS in pregnancy because, well, I'm navigating it now. And if you are experiencing these same or similar symptoms, then if you're pregnant or you are thinking about becoming pregnant, I want you to have this information too. I'm so stoked to dive into this topic with you guys. And honestly, you're going to fall in love with Dr. Zac because he is such a wealth of knowledge and he presents this information very straightforward, but in a very sensitive way as well. All right, without further ado, Dr. Zac, welcome to the show.
Thanks for having me. Excited to be here.
Yeah, absolutely. I'm so excited to have you. And my audience knows that I have, in the last couple of years, been going through my own diagnosis of MCAS. And so I think this is a really interesting topic, not only for me, but all of my audience members who may be dealing with some sort of histamine issue or maybe having a diagnosis journey of their own. Thanks so much for being here. I'm very, very excited. And I think a really good place for us to start is probably to let you define what MCAS is, especially for someone who isn't familiar or for someone who might be experiencing symptoms and they didn't know that there was an explanation out there.
Yeah, it's confusing for providers alike. So I'd be happy to dive into it. Man, so it's an acronym that stands for Mast Cell Activation Syndrome. And I think the best way to understand it is to get a sense of what mast cells do. So mast cells are these really helpful cells that primarily live on the surfaces of our body that interact with the outside world. So our skin and also our GI tract. So our GI tract is also a way that the inside of our body samples the outside world, right? But they also exist in our nerves, in our brain, in our heart, in our vascular system. So they're ubiquitous, they're everywhere. And they're super helpful. So by design, they do a lot of important things for our body, namely maintaining the integrity of our gut barrier and preventing quote unquote leaky gut, right? They offer defense against a lot of pathogens, viruses, bacteria, parasites. They regulate our immune system, really important things. However, in mast cell, they start to get a little twitchy, a little finicky, and they start to do their job when we don't really want them to do their job. It's like the neighborhood watch who is really good at preventing criminals and people speeding, but then they start calling you all the time when someone like littered or like fairly innocuous things, and they just start getting annoying. And that's what mast cell activation is, except you're not really annoyed by it. It can be completely, it can completely overthrow your life and control over your own body. So it can be quite challenging. And yeah, so it can cause a whole host of symptoms because mast cells are in multiple different organ systems. So everything from brain fog to fatigue to headaches to migraines, goodness, to nasal congestion to wheezing and shortness of breath to palpitations to bloating, diarrhea to pelvic pain to menorrhagia, pain with sex. So it can manifest in all these different ways. And so it can be quite challenging to know what's necessarily causing your symptoms. Is this something like reflux disease or irritable bowel syndrome, or is it MCAS? And that's where, it's wise to talk to an MCAS savvy physician so they can kind of start to put these pieces together, because it can be tough to understand what's what.
I have so much to say about what you just said. So my symptoms are anaphylaxis. It starts with itchy skin, and I can always tell because my skin gets really itchy, and then where I scratch it gets really red, and I'm like, oh no, I'm about to have an MCAS attack. And then it is full body hives, and then it's anaphylaxis, and there is typically some sort of GI upsets. Sometimes it's vomiting, sometimes it's diarrhea, and it is for me filled with urticaria. It's a full body thing. And then I typically I'm able to go to sleep. I take Benadryl and it is always put it to rest. And then I go to sleep. And the next day for me, I'm very fatigued. I am very just, I guess, brain foggy, but there's a lot of confusion too. And my body is so sore. And so the first time that this happened, we actually thought that it was from food. And I said, okay, well, I just won't eat shellfish anymore. It must have been the crab cakes I had. And then the second time it happened, I thought, okay, well, maybe it's because I rubbed up against that plant. And then the third time it happened, there was nothing. And now I've had upwards of 12, 13 attacks. And there is no singular thing for me that has made my attacks all the same. And the one thing that we were doing before I got pregnant is we were tracking when the attacks happen in congruence with my menstrual cycle to see if that had anything to do with it or if it had anything to do with the cortisol levels. And so I was going for regular blood work to keep up with kind of my cortisol levels. I had done a couple of Dutch tests as well, just to see if we could maybe track down exactly what was going on. So, talk to us about what causes these mast cells to go haywire, especially if we've got audience members that are like me, where you're like, I keep having these attacks, and there's no one thing that seems to be causing it.
How much time do you have?
All day.
So here's the rub, is that they're so pesky and they can be irritated by everything. So I think you mentioned, we asked an important question in terms of what causes, and that's what we always want to figure out. I will say that we're not always successful in doing so. And so this could be anything from an autoimmune cause. So when someone comes in, one of the first kind of surveys that I do is get a sense of kind of who they are, what other diagnoses do they have, and do they have this kind of autoimmune milieu? Do they have rheumatoid arthritis and psoriasis and history of Sjogren's, and which are all autoimmune conditions that kind of autoimmune conditions kind of travel in packs, right? And so if someone has a few, they are likely to have others as well. That's a cause. And that also, if someone has an autoimmune foundation for their MCAS, then that does speak to certain therapies that we can use down the road. So that's very helpful. Some people have POTS, or postural orthostatic tachycardia syndrome, which is an associated condition that can exist on its own, but there's a huge overlap with MCAS. And we know that POTS can make MCAS worse. And similarly, MCAS can make POTS worse. So they're kind of pissing each other off and yelling at each other. And you just need to kind of get both under control. And that's certainly easier said than done. Mm. We know that viral conditions can kind of flip on our immune system. So COVID most notoriously has done that, where MCAS was a rather kind of dormant, not really spoken about condition, but post-COVID, there's been an explosion of this. But not only COVID, but vaccines as well. So you hear it after the shingles vaccine and COVID vaccine. So it's post-viral is a big trigger as well. You mentioned hormones. So estrogen and progesterone can irritate mast cells as well. And conversely, testosterone can be more of a stabilizing factor in mast cell. And that's why we think that men typically get mast cell less than women. In fact, there have been studies of women who have transitioned to men, and when they started testosterone replacement therapy, their mast cell activation syndrome cooled down a bit.
Wow.
So it's complex. There is no rule book. There is no algorithm. As someone who loves algorithms, I like saying, okay, this person has this symptom and we see this test and then we do this. It doesn't work that way. There is no rule book. It's keeping an open mind, and unfortunately a lot of trial and error, which can be very frustrating for patients and to a lesser degree frustration for physicians as well, because we're trying so freaking hard to get our mind around what's going on. And we work with you diligently to understand triggers. And sometimes that doesn't work because there's so many triggers out there. To your point, it could be temperature changes, barometric pressure changes, stress, sleep, diet, medications, supplements, like goodness, the list goes on and on and on. So yes, we have that dialogue, but sometimes it's just using therapies to really, or it's understanding why it's there to begin with. Like if you have POTS, treating the POTS, and then sometimes using medications to calm down those mast cells.
You know, it's so interesting, not to be a conspiracy theorist, but it's so interesting to hear you say that the COVID vaccine kind of did this, but maybe has caused a spike in it, because I never had this in my life till we got the first COVID vaccine. And about 6 months later, I had my first attack. And now I have them about 4 times a year. I am very interested and I've been talking to you guys in my DMs about this, but I'm very interested to see how this is impacted by pregnancy. Will pregnancy get rid of it? Will I have any attacks in pregnancy? How will my body respond to this? I actually went through a period of being worried about being able to actually achieve pregnancy, because I was a little worried that the mast cells may get finicky and angry at the pregnancy itself and then attack that. Do we have any data around like MCAS and pregnancy?
I think generally speaking, the data is pretty sparse everywhere,
Mm,
but it's kind of unpredictable. But there can be complications in pregnancy. And so if for my patients who are planning to become pregnant or are pregnant and they're dealing with mast cell activation syndrome, I get on a phone call with their OBGYN pretty quickly to talk about kind of where we are, how well controlled the mast cell is. So I think it's not a foregone conclusion that things are going to get better or worse. I think by the nature of the beast of MCAS, it's unpredictable kind of wild ride, which can be really frustrating and kind of scary as well. So I think it just takes your OBGYN, and if they're savvy to MCAS, beautiful. But if not, then them working hands in hand with somebody who does to make sure the mast cell is optimally managed as the pregnancy continues.
And what would that look like? So, one of the remedies that I found very helpful for me, and I've talked to you guys about this before, but I ended up having to go outside of mainstream medicine. I didn't know Dr. Zac at the time. And I actually ended up having to work with a naturopath. And she is the one who was able to help me get this diagnosis, figure out what it was. And I was on a regimen of supplements to help keep this at bay, and it had worked. My last attack was actually in February, literally a week before I got pregnant. It was the weirdest thing. And before that, it had been several months, which was one of my longest stints. And so we were really proud and happy with the regimen that we had done. And one of the base of that was Zyrtec. So if you're talking to an OB about a patient, I know it's very individualized, and obviously the disclaimer that Dr. Zac is not your doctor and this isn't medical advice, and you guys know that. But what would that typically look like in terms of thinking about managing it in pregnancy? Because pregnancy is one of those things where we have such limitations in what we can do and take.
Yeah, I think similar to every MCAS patient, a lot of it is designing the therapeutic protocol to who you are and what your symptoms are.
Sure.
So the basement floor, the ground floor of MCAS treatment is identifying triggers, which again is hit and miss. It'd be nice to be like, boom, if I take out carrots and I stop watching the Kansas City Chief on Sundays. I'm not a Chiefs fan. Sorry for all those Kansas City fans out there. Then my mast cell would get under good control. But it's not that easy. So we do use medications. On the ground, we do histamine blockers are a nice place to start because they are so well tolerated and they're quite effective. Not for everybody, but they can at least turn down the volume a little bit on the mast cell activation. And then if you're not achieving great control on H1 and H2 blockers, and I'm sorry, H1 blockers are Zyrtec, Allegra, medications that are traditionally used to control allergies. And we use that in combination with H2 blockers, which is the most common one is famotidine, which is typically used for gastroesophageal reflux disease. So we use these in higher than typical doses for those aforementioned diagnoses. And then if we're not making any progress there, then we layer on therapy. And a lot of the therapies we choose are quote unquote mast cell stabilizers. And they all kind of work in different ways and have certain advantages and disadvantages. So it takes understanding your symptoms, what other medications you're taking to make sure there's no interactions there, which will then dictate what our therapeutic strategy will be. So for example, if you have a lot of GI symptoms like bloating, diarrhea, cromolyn is a nice option there. If you have a lot of pain, there's a supplement called PEA that's really nice. So there's a lot of different options there. And if you came to me and you had a lot of anaphylaxis, I'm thinking Xolair, which is an antibody therapy that works really well because, if you've had anaphylaxis, I'm scared. I'm like, you need to carry an EpiPen at all times. And if you have anaphylaxis during pregnancy, that's a pretty anxiety-provoking situation. Admittedly, I don't know how safe Xolair is in pregnancy, but that's something that I would look up and talk to your OBGYN about. So then you talk about the safety of these medications in pregnancy, and by and large, they're all pretty safe. But again, you don't want to expose a fetus to unnecessary medications at all. So it's that careful balance there. And yeah, so I wish I could give you a clear-cut answer here. I really wish I could. But a lot of it's really patient-to-patient dependent.
Yeah, and look, nuance is the name of the game around here. We're very used to nuance and we're really used to that individualized care. And we're really used to, especially as women, not having a lot of answers about our bodies and our health care and the research that we have. And it's certainly not your fault. I think what you're sharing is super helpful, especially for someone out there that's walking around having some of these symptoms and not knowing what to do or who to see or what questions to ask. This is super helpful. So now my brain is just kind of wandering because my two worlds are overlapping. So we've got this mast cell activation and it's this immune response, right? And then we have AFE, amniotic fluid embolism, which the latest research is showing that it is actually an immune response when the amniotic fluid gets into the bloodstream. So is there any data / do you know / have you heard anything about there being any overlap or crosshairs between mast cell activation and the occurrence of AFE?
Wow. So I am a gastroenterologist, and goodness, I haven't thought about embolisms of this type in 15 years. So I really wish I could comment on that, but I don't. What I do know is that the immune system is it's complicated and even more complicated in pregnancy. So I take care of patients with inflammatory bowel disease. And ulcerative colitis they get better in pregnancy, and Crohn's disease tends to get worse. Not sure why. It's just the immune system is just it's very nuanced.
You know what? I'm actually not surprised to hear you say that. I'm not sure that the data actually exists. I have asked my hospital-based midwife, I've asked my home birth midwife, I have several MFM friends, I have several L&D nurse friends, and no one seems to know. I actually am really good friends with the AFE Foundation, and they don't even have the research. And so I think it's just kind of this big question mark out there that as we get more information on MCAS and AFE, if there's any overlap, that will come to the surface. Dr. Zac, one of the things that kind of drew me to you was your really unique background. So you call yourself a neuro gastroenterologist. Tell us about that, because I don't think that a lot of people are going to put two and two together with that.
Yeah, I don't love the name. I'll be the first one to say that. I really wish we
Okay.
need to come up with something like way shorter. Once you go beyond 3 syllables, we're doing too much. Right?
Okay.
So I think it's too much. But basically, I deal with more software issues than hardware issues. So if you come to a GI doctor, right, and you have symptoms, and we're trying to identify what is driving those symptoms. One of the first things they will order is endoscopy. And they may pair that with imaging tests as well. And endoscopy is effectively looking at your esophagus, your stomach, your small intestines, and your colon as well to identify if there's inflammation, ulcers, malignancy, inflammation, etc. And so more often than not, and so less than 50% of the time, when patients have this evaluation for whatever symptom there is, there are no answers, right? And so they wake up from their endoscopy and they're like, "Doc, did you find out what's going on?" And they're like, "No, but it's good news. It's not cancer. It's not inflammatory bowel disease. We're good." But they're like, "So what's next? Like, why do I feel this way?" And that's where I come in. And so I think, and I'm painting with a broad brush, but traditionally a lot of these patients were labeled as having quote unquote irritable bowel syndrome. And some of these patients do have IBS. And that's kind of a different story altogether. Like, what is IBS? Because it is a collection of symptoms, but doesn't really describe the pathophysiology of what's going on. And some of what I do is teasing out, do you have quote unquote IBS? Or do you have something else like mast cell activation syndrome? Do you have motility disorders where the intestines on paper look fantastic? Like the walls look beautiful, they're glistening, there's no ulcers. It just looks wonderful. You could put it on a Christmas card and send it to your mom. I wouldn't recommend that. But they just move. They're not working in harmony. They're not working in coordination. So yes, the GI system is effectively a tube, but that tube is very coordinated and very nuanced and awesome. And in a very kind of, digestion is a beautiful dance. And if there's any hiccup in any part of that process, it results in a lot of symptoms. And depending on where the wrench in the chain is put in there, then that will manifest in different symptoms, whether it's constipation, bloating, diarrhea, pain, etc. And that's the work that I do.
Wow, I love that so much. I feel like you are so much more, dare I say, holistic, whole body, whole person than a traditional gastroenterologist. And I think for me, that's where I was like, okay, this is someone I want to have on the podcast because you are thinking more whole body than just, all right, the scans are great, everything must be good, which I think as women, we're a little jaded because we hear that so often. We get the answers that, yeah, your labs are great, so you must be healthy. And we're like, no, I have all these symptoms. I'm telling you something is wrong, which is ultimately what pushed me out of the mainstream medical system into the naturopathic route. And for me, it won't be the same for everybody, but that ended up being the right answer. And I was just really drawn to the way that you look at the whole body and the whole individual.
Yeah. And so it's the tools that we have in medicine just sometimes aren't very good,
Yeah.
right? Like endoscopy is good at some things it's good at certain purposes. Colon cancer screening, if you're bleeding, if you can't swallow, like all these tests are very good. But when someone wakes up from an endoscopy and the test is normal, they're like, "I can't believe you didn't find anything." I was like, the test just isn't very good.
Hmm.
It's not that nothing is wrong. And the body is far more nuanced and complex than something that can be boiled down to just an ulcer or inflammation or something like that. And as we all know, we've all known somebody, if not ourselves, when we were kids, we got a little frustrated or anxious and our stomach started hurting. Or you get butterflies in your stomach, or you're giving a big talk and you have to kind of jet to the bathroom before you give a big talk. Like that communication between the brain and the gut is very real. Our gut has a second brain. It's called the enteric nervous system that communicates with our central nervous system, which is our brain and our spinal cord. And in neuro GI, a lot of the diagnostics and therapies that we look into and employ look at both the GI tract and the brain and how they communicate with each other. So not only are we talking about what you eat and what you put in your body, but how's your mental health? What trauma has existed out there? What's your stress level like? How do you sleep? What supplements that you take? Because it all is baked into the equation when we're trying to understand someone's digestive health.
Yeah, I think so many people think that leaky gut is just your gut, but there's so much that goes into it where you're like, yeah, it is your gut, but we also have to fix all these other things as well in conjunction if we're really going to get you to a healthy place.
Yeah, leaky gut's kind of a tricky beast too because it gets thrown around a lot. But
Mhm.
even the people who are complete experts at leaky gut are kind of like, we're not even sure what this is. But we do know that's a problem, but we don't really know. I guess at its core, it's increased intestinal permeability, which is where stuff from inside your GI tract leaks outside of your GI tract, causing a lot of inflammation, nerve sensitivities, and in turn, brain fog, fatigue, anxiety, depression, autoimmune conditions. The question is, how do we fix it? And that's a really challenging question. But I suppose that's what we try to do in clinic, because a lot of it boils down to how are you eating? How are you feeling? How are you sleeping? How are you moving your body? Because all of that plays such a big role into our GI health.
So, for someone who is having some of these symptoms, not leaky gut, but back to MCAS, how might MCAS be different than something like systemic mastocytosis or histamine intolerance? How are we telling these apart? Is this something based on symptoms? Is it based on testing? Are they just completely different, or is there a little bit of overlap?
Great question. So these are categorically different from each other. And I would say that histamine intolerance lives in a different camp than mast cell activation syndrome and systemic mastocytosis.
Wow, okay.
So let's talk about histamine intolerance. And so histamine intolerance is where you eat something that is high in histamine load or enables your body to secrete more histamine. And once you eat, that histamine load gets absorbed into your body. Traditionally, and how your body is supposed to work, is that when you eat a big histamine load, we have an enzyme called diamine oxidase that converts histamine to histidine, and histidine is not bioactive and can't create symptoms. But in histamine intolerance, the thought is that diamine oxidase is deficient or functionally not working very well. So you have a lot more histamine in your body, causing flushing, diarrhea, bloating, palpitations. And so that exclusively happens after eating a high histamine meal. Okay. MCAS. So that is a mast cell problem. And mast cells secrete histamine, but they also secrete 1,300 other chemical mediators that can run amok and wreak havoc in your body. And it's not always tied to what you eat. And so, as you mentioned, it's not like you eat a ham sandwich and your heart starts racing and you get flushed. You could brush up against a tree, right? You can get your mother-in-law calls you who you don't maybe not get along with quite well, or your favorite football team loses, or I don't know, you travel to Colorado and you go up 10,000 feet. And so MCAS is a lot more finicky and challenged to identify what caused it because it's not just food. Mm. And so in histamine intolerance, the treatment is a lot less elegant than an MCAS. We try to decrease the amount of histamine that you're eating. And so there's different kind of protocols for how to reduce your histamine intake. We sometimes supplement with diamine oxidase enzyme because that helps convert that histamine to histidine. And sometimes we can use H1 and H2 blockers like we had mentioned. In MCAS, the low histamine diet works to some extent. But again, if you're not controlling the mast cells, you're not going to get very far. So that's where we use medications to really, really quiet down the mast cells. And the systemic mastocytosis is more of a pre-malignant condition, where in mast cell activation syndrome, you have normal amounts of mast cells, so to speak. They're just functionally more finicky and twitchy, where really, the wind blows too strong, then they're going to elicit all their chemical mediators. In systemic mastocytosis, there is a lot more mast cells. And so it's considered a pre-malignant condition. And so a lot of the tests that we use to evaluate for MCAS can similarly be positive in systemic mastocytosis, but there are genetic changes as well that we can screen for that would tell you if you have systemic mastocytosis instead. But the symptoms can overlap, but the symptoms in systemic mastocytosis tend to be more severe than in MCAS. Yeah. But the treatment is fundamentally different.
And they're fundamentally different diagnosis. It sounds like people experiencing them have different experiences. What kind of testing are we doing to determine these types of diagnosis?
Yeah, so when you are looking for mast cell activation syndrome, one of the challenges is there's so many freaking challenges with it. Not
Don't
only
I
is it
know it?
identifying triggers, but it's diagnosing it can be really tricky. So they elicit all these different chemical mediators, right? Over 1,300. But our testing is only so elegant to be able to identify a few of them. And not only are the tests themselves, they lack sensitivity, which means that even if you have it, they may not be able to detect it. But these tests have to be handled in a very specific protocolized way. And if your lab doesn't handle them properly, then they may be inaccurate. But the most commonly used test for mast cell activation syndrome is a serum tryptase, which is notoriously unreliable and insensitive unless you're actively flaring. But then we have a collection of 24-hour urine collection studies that can be very helpful as well. N-methylhistamine, leukotriene E4, prostaglandin D2 are a few ones that we use. In systemic mastocytosis, that tryptase will reliably be elevated, and then you can test for genetic markers called c-KIT mutations that will tell you whether you have systemic mastocytosis.
Now, would these be tests that someone could go to their doctor and ask them for if they felt like they had these, or is this something that we are needing like an allergist or specifically a gastroenterologist for?
That's a really good question. So I will tell you that I think a lot of providers in this day and age will read up to date or some kind of generic medical education page, and they will say, order the tryptase. And if it's negative, they'll say, looks like you don't have MCAS, which is, we know, not exactly true. So these 24-hour urine collections, I think, can be done anywhere. I'm part of an academic center where those tests are available within our system. But I think you can get them done at a lot of the private lab companies out there like LabCorp and Quest as well.
That's amazing. Yeah, I love that. I love that so much. Okay, you keep talking about high histamine foods. We've mentioned it several times. When I first started working with my naturopath, that was one of the things that we did. I kept a food diary because I didn't know what was causing my attacks. I had no idea. I felt like some of it was food, but then I also felt like some of it was environmental. And so one of our very first things was to keep a diary, and it was to keep a diary of what I did and if I came into contact with any new plants. My naturopath is not in Massachusetts with me, and so she wanted to know about the pollen count in the area, and I kept a very specific log of the food I ate, not only what food I ate, but how I prepared it. And then she gave me this list of high histamine foods, and I felt like it was everything I was eating. And so I was just gutted, and I was like, oh no, these are my favorite foods. Luckily, I was able to add these things back into my diet, and we found that they were not problematic. Some of them I'm limiting, but I'm not on a very restrictive diet. You guys know I'm super against that. I like to eat what I like to eat when I like to eat it, and I don't want to be on a restrictive diet, although I am cognizant about the high histamine foods. So, can you tell us a little bit about what foods are high in histamine and for someone who might be walking this path, what that might mean for them?
Yeah, I think if you throw the book at somebody to follow a low histamine diet, they're going to be pretty overwhelmed pretty quickly.
It
And
sucks. It's horrible.
yeah, so there's a way to do it that I think isn't totally backbreaking. And I always try to get a sense of what the person eats as opposed to saying, hey, don't eat all of these things. Because I also don't believe it's completely binary either. I don't think you probably have to avoid everything. I think there's probably an inflection point where your body's too much histamine. I can't do this anymore.
Yep.
So I try to meet the person where they are first. And I want to give naturopaths a huge shout out because I am allopathically trained and
Nice.
we don't go into the nuance of kind of pollen count and mold and all of that stuff. So I ask general questions about it, but I appreciate all that they're doing. So
Yep.
I'll leave it at that. But yeah, let's just talk about like why histamine happens. And it's a product of fermentation. And so what so fermentation happens when bacteria have time to turn molecules in the food into histamine. And that's part of their natural life cycle. So foods that have just been sitting out for a while are probably an issue. So aged cheeses, dried fruits, processed meats, so bacon, salami, alcohol's a big one, right? Because that's literally made by the process of fermentation. And so that usually, unless you like live and die by charcuterie plates, which by all means, I love me a
And that
charcuterie plate,
is me. I love
100%.
charcuterie
That's a
boards.
histamine, just TNT overload. That's just, you're asking for punishment there. But unless you're doing that, right, which most people aren't consuming 3 charcuterie boards a day, the biggest issue that I find is leftovers.
Yep.
Because leftovers by nature are going to have some bacterial product in them after you cook it, even at refrigerator level temperatures. And I had a gentleman the other day who is on the carnivore diet because he had all these issues, which ultimately were due to histamine intolerance and maybe an element of MCAS as well. So he did carnivore. So he hit the farmer's market on Saturdays, cooked up pounds of meat on Sundays, refrigerated it, and then every day would just take down a pound of meat a day. And he still felt miserable. And he did all this amazing stuff. He cut out all the processed foods and he was sleeping great and exercising. But it was just that leftover ground beef was just loaded with histamine. And so there's a way to do it where it's not as problematic. But generally speaking, like the fresher you can make everything, the better. But that's just also not a reality for people. If you work a 9 to 5, like you can't just occupy the employee kitchen and make sashimi and things like that. That's ridiculous. So how do you make it work? And fresh fruits and vegetables are great. But if you can cook something the same day, perfect. If not, cook it and freeze it and then have to reheat it from frozen, which can be a challenge. I know. But with a little planning, you can really make this work. And that's usually my kind of my first tier or my introduction into the low histamine diet. And if you remain symptomatic despite that, but usually we do a pretty good job there by mitigating leftovers because we all love leftovers. But I think if you take that away, a lot of people become successful. But then the next level are foods that liberate histamine from your cells. And so those are avocados, tomatoes, spinach, eggplant, citrus fruits, chocolate nuts. So it gets weird and nuanced and very restrictive. So I always layer this in. And what I do is I start with the introduction diet, and then have touch points every couple weeks. So in 2 weeks, I'll say, hey, how we doing? And they're like, man, I'm really flushing. My heart's racing. This is not going well. Then I'll reinterrogate the diet and see if there's anything additionally we can cut out.
Yeah, you guys, I gotta be honest. I'd rather just have anaphylaxis every day than give up chocolate and avocados. It's just a risk I'm willing to take, you guys. No, I'm kidding. I'm kidding. Anaphylaxis is actually very scary and it's a really severe thing. So I am making light of it, but
No,
it's
but your point is
heartbreaking.
well taken because there's some people who are like, I don't want to take any medications. They come in here, lay down the law, and I was like, cool. Like I support you in whatever way you want to be supported. And then we get into the diet. They're like, give me the medications. Send me
Yeah.
all the prescriptions. I'll go to CVS right now. I'll double
Yeah.
dose it. And so but it's a balance, right? Because yes, we can be dogmatic and treat this by the book, but sometimes that's not fun. And a lot of these people are in their 20s and 30s. And realistically, are we doing this for 6 decades? So we have to find that balance that works for you. And
When I,
sometimes, as you said, a little bit of itching and a loose stool here and there, if you're able to eat some brie on some bread, like maybe that's the balance you want to strike. Like, absolutely, man, do that. But and that's why it's never just throwing a diet at someone. It's trying to get a sense of what people's goals are and how they foresee themselves being healthy.
Yeah, I really appreciate your approach. That's the approach that my naturopath took as well. And like I say, we looked over my diet and then we looked over the high histamine foods that I had the most. And instead of taking them out, she just said, let's reduce them to this amount of times a week, or let's try and cut that in half. And so it really did work. One of the foods I was most sad to lose was bone broth. Talk to us about that.
The fermented food. So you cook it and it steeps, and that's probably has a lot of histamine in there. I have not a lot of kudos to you. It's very healthy. Not a lot of people where I live eat bone broth. So I just shout out to you and your health. That's not something that I've come across, but I imagine, just understanding how histamine gets created, I imagine that'd be high in histamine. But again, it's a balance, right? So if you say, look, I can't live without this, cool, let's try some DIO enzyme and maybe try to temper the histamine in other places in your diet. And maybe instead of eating a bowl, let's start with a cup. I don't know what servings of bone broth exist or what's satiating. So I think you just tailor it to everybody. And there's no science here. And Some of it's trial and error and giving it a shot for a week and seeing how it works. And if it doesn't work, then we turn the dials. If it worked, sweet. Maybe let's liberalize the diet a little bit more. We're always working to get not only better control of the condition, but get you more quality of life, I suppose, on the current medications and diet restrictions that we've implemented.
Yeah, I feel that. So it was a dagger to my heart because I used to drink bone broth every single morning. I would have my coffee and then I would have a cup of bone broth, and it was just such, oh, it just left such a hole in my life. And I would have bone broth, hot chocolate in the winters. And our winters in Boston are brutally long. And so I really felt like I was losing a best friend. And so that was probably my hardest thing to give up, was the bone broth. And not to say that I've cut it out completely. I don't sip on it anymore. We still cook with it. And so that leads me to my next question is, does cooking our food or anything fermented like that, would that help to heat it up? Heating up leftovers, does that help or no? It's really once they've been in the fridge and they have fermented like that, they are what they are.
As soon as you finish cooking that meal, the timer starts.
Oh,
And bacteria is on there and it starts to ferment. So you cook it, you freeze it, and then at frozen temperatures, there's no histamine being made. And so the next day, you heat it from there. And as it's warming up, right, from frozen, there's going to be some histamine being formed. But between heating it up from frozen and eating it, that shouldn't be a ton of time.
yeah.
So I think, yeah, that'd be the way I would do it.
Yeah, it's so funny to hear you say that about leftovers. I have always been like not anti leftovers, but I will open up leftovers and I just don't want to eat this. And I always felt so guilty because I felt so wasteful. And I think it was really a primitive thing. I think my body was saying like, no, don't eat these. Or maybe I'm just bougie and my brain now is, oh yeah, that's justification for you being this bougie girl that doesn't want to eat leftovers. But I have always been like really resistant to eating leftovers. It's been something that has been present in my life for as long as I remember. I remember getting in fights with my parents being like, I don't want to eat this. And they're like, why? It's perfectly good food. And I could never put my finger on it.
You're having your first child, right?
I am.
You got to learn to love leftovers. You got to have those easy buttons in the fridge. You're not cooking every night. So that's why, at being a parent, I understand pizza night twice a week. I understand taco night. I understand leftovers, easy buttons for cooking. So you got to learn to
Yeah.
love leftovers. And I agree. I generally don't love the leftovers. Leftover pizza, I'll make an exception for. But outside of that, I do like it fresh. But with kids, man, it's just thinking about what else you're going to cook to that night is another layer of anxiety and stress to the day that you don't want to stress out your mast cells even more.
Yeah, just the mental load. Okay, that is the perfect segue to my very last question. And that is this genetic? Are we passing this down to our children? And is it possible that we got it from our parents? Or is it more something like your genetics loaded the gun, but your nature, nurture, environment pulls the trigger type thing?
I think it's probably the latter. I think a lot of these conditions, similar to a lot of conditions that we see, are polygenic. And so there's multiple genes at play. And there's also kind of epigenetics at play. So it's not only the genome that you were born with, but something gets turned on at some point in time. But I'll also say that MCAS is rather heterogeneous. Not everybody's the same. So what happens if you have Ehlers-Danlos? And there are a lot of subtypes of Ehlers-Danlos that have genetic underpinnings. Not all of them, but some of them do. And Ehlers-Danlos can, in some ways, lead to Mast Cell Activation Syndrome. So is that an exception? I think so. But is mast cell caused by a specific gene? Perhaps indirectly in that situation. So I think it's probably you're born a certain way, predisposed to autoimmune conditions, as unfortunately a lot of women are, and then something happens, right? Anything from head trauma. I've seen postpartum MCAS before,
Wow.
as we spoke about COVID, vaccinations, emotional trauma. There's a big relationship there as well. And so, yeah, it's not that it's a ticking time bomb, but certainly there's some genetic underpinning and then something flips the switch.
Yeah. Oh my gosh, you're speaking right to my heart. I just feel it. I can feel how true this feels, and I imagine that my audience feels the same exact way. Dr. Zac, thank you so much for being here today. This has been an amazing episode. I've learned so much. I felt like I came into it with semi-mediocre knowledge. I've lived this life for the last 5-6 years, and so I was like, oh, I've got a good foundation, but you just really, you laid it out in a very simple, transparent way that I think was very digestible. And for people who are wondering about diagnosis, or maybe they're walking their path to diagnosis, this was a really comforting conversation. So thank you so much for that. If people wanted to connect with you and learn from you, or maybe if they're in your area, where can people do that? Where can they get connected with you?
Yeah, so I have an Instagram, Dr. Zac Spiritos, where I try to offer information about complex topics like irritable bowel syndrome, some more nuanced GI conditions like cyclic vomiting syndrome, to POTS and dysautonomia and mast cell activation syndrome. We are opening our own clinic in June, which is a telehealth based clinic that is meant to help folks who have been left out there putting together the pieces of the puzzle themselves, who have had all the tests and everything is coming back normal. I am a GI doctor, so I treat a lot of GI conditions, but we also treat dysautonomia as well. So the complications of postural orthostatic tachycardia syndrome, including mast cell activation syndrome. Yeah, that's very exciting. It's going to be a telehealth based group to offer accessibility to a lot of people out there who are otherwise struggling. Yeah, so that's opening in June. If you follow my Instagram page, we'll be giving more information about that soon. We also do weight management. My partner in crime is a weight management physician out of Northwestern. He's fantastic. And I do a lot of GI conditions that I see in clinic. Weight plays some role in them, not everything, reflux disease, diverticulosis, etc. So weight management is something that I care a lot about. And so we'll be offering those services as well.
Nice. Congratulations on the opening of your clinic. That's awesome. I'm very pro telehealth here. I have long been on the telehealth train, and I think it's just such a really wonderful way to expand access in our country where there are so many healthcare deserts, and you've got so many people who don't have access to proper healthcare, safe, consensual healthcare. I am so grateful for that, and congratulations on that. All right, you guys, I'll see you in the next episode. Be sure to follow Dr. Zac on social media, and you can find me at Tranquility by HeHe and at the.birth.lounge. Until next time, head to your app store and download the Birth Lounge app for evidence-based childbirth education and data-driven postpartum support delivered straight to your phone. Bye. Thank you so much for tuning in today. I love hanging out with you, and it is an honor to be your go-to gal when it comes to preparing for your baby. If you've enjoyed today's episode, please leave a 5-star review and tell others why they should be listening to the Birth Lounge podcast too. You deserve to have a birth that you love with a provider that values your autonomy and respects informed consent without all the trauma that you so commonly hear about on social media. New episodes air every Wednesday and Friday. Hit that follow button so you never miss an episode. I'm HeHe, and this is the Birth Lounge Podcast.